This report tutorial is intended to assist you as you interpret results for female patients taking sublingual progesterone, which is a particularly difficult scenario to test well. So you can see in the upper left-hand corner what I'm showing here is just an average result from a postmenopausal woman. So you can see on the right how we plot this. The postmenopausal range is that little purple band, and further up you'll see the first star, which represents the low part of the premenopausal range, which then goes all the way over to the higher part of the premenopausal range. So you typically find non-supplementing postmenopausal women, as this set of results is, down in this purple band. So what you need to know is that it's a little bit different situation with progesterone, and here are some numbers that are worth considering. The postmenopausal woman for this top metabolite, beta-pregnenolone, is usually around 50, as this woman is. If she's premenopausal, she's likely to be closer to 1,000. It's about a 20-fold increase when you're ovulating and making progesterone, as a premenopausal woman is expected to. When you take oral progesterone, we're measuring a progesterone metabolite here. So when you take it orally and you get a lot of first pass metabolism, meaning hormone that goes into the gut and then gets turned into these metabolites very extensively as the progesterone makes its way through. So with oral progesterone of 100 milligrams, which is a very standard dose, it's not too much progesterone for someone supplementing with progesterone, but the urine values are up around 5,000, 5 times higher than the premenopausal average. So then with sublingual progesterone testing, it becomes tricky because you're trying to take it and have it absorb in your mouth, within your gum line, if it's more of the buccal application along the gum line, or under your tongue, which we would consider sublingual, which could be a lozenge, could be drops. But if you swallow any of the progesterone, which most people do just in the normal course of taking it by this route of administration, you can get elevated values. So if this woman is on progesterone sublingually, and look at these results, they're out of range on the high side. Now, why could that be? It could be 2 reasons. One, you give your patient too much progesterone. She puts it in her mouth, doesn't swallow any. It goes in under her tongue, into circulation at very high levels. Then you make these metabolites, and these are the sorts of results that you get. Or she takes a very appropriate dose of sublingual progesterone, swallows maybe 10%, 15%. That would be all it would take to add a very significant amount of metabolites to get yourself these sorts of results. So if you're swallowing the typical 20, 30% of the supplement, because oral progesterone gives you very high levels of urinary metabolites, elevated values don't necessarily mean you're taking too much progesterone. They could just mean you swallowed a fair amount of it. So if the patients are very, very careful and they don't swallow any of the oral progesterone, it can be a useful value. But most of the time with sublingual progesterone, there's a fair amount of uncertainty there as to what the results tend to represent. So it's a very complex scenario. The oral progesterone video might be worth watching to get some additional clarity on this, but you have to be careful, not in taking sublingual progesterone, but in applying laboratory results to the dosing of sublingual progesterone, because it is a somewhat tricky scenario in terms of how the lab results end up.